Hello, everybody. This is Darshana, and today we have wonderful Mia with us to talk all things fun. So
Yes,
I hope you're sitting at the edge of your chair for this one, because I am. So, Mia, thank you so much for taking the time. Um,
my pleasure.
would you mind introducing yourself for our audience?
I'd be happy to. My name is Mia Fine. They, she pronouns are great. I am a ASEC certified sex therapist and licensed marriage and family therapist in both private practice and group practice in the Seattle area of Washington. I'm a queer, white, non-binary femme, and I'm also an introvert. Somewhat, I have neurodivergence in me, and I am an avid outdoors human and really love adventuring. So those are some components of the identities I hold and who I am as a
You
person.
you forgot kick-ass, you forgot awesome, you forgot
Oh, well,
many
thank
there.
you. I appreciate that. And I'm really glad to be here with you, Darshana. You and I have been collaborating for a while now and have shared some really fabulous cases. And I think very highly of you as a person and a professional. You're awesome.
Right back at you. The collaboration is the fun part,
Yeah,
right? It's
it
just
really
you
is.
learn so much from each other. It's amazing, that process of growth. So thank you.
My pleasure.
What I wanted to talk about today is we did another episode about what sex therapy is, sort of as an introduction, because a lot of people don't know what sex therapy is and how it is different than any other therapy. What would you say is something unique about your approach to this? Because as much as this is a science, I feel like everybody brings their art to it. So can
Mhm.
you speak more of like your approach to these things?
Sure, absolutely. A couple things come to mind. The lenses I offer and the theoretical models and the approaches that I'm a student of queer theory, intersectionality, social justice, racial justice, transformative justice, disability justice. And I am definitely a student in them in these areas. And with the principles, that's how I intend to help folks through their process in healing by identifying what their identities are that each person holds and how it relates to power and oppression. I think it can really make a lot of sense to navigate those identities and how we move through the world that we currently have. Also, I've kind of honed in on, so I share that up front, and maybe I'm a good fit for some folks, and for other folks I might not be a good fit, and that's okay. We don't have to be a good fit for everybody. And that goes for clients, patients, as well as clinicians. um, and another is the way that I do my timeline in a somewhat linear chronological fashion. I do an individual session with, let's say I have a dyad who's coming to me for relational therapy, or an individual, either. And we have a session together. And then I do individual sessions where they start with 90 minutes and then we have follow up sessions. And I walk through a sexual biography, a history, in a somewhat, as I said, chronological linear fashion, exploring messages folks have received growing up from their families of origin, their first families, from society, from different culture, from religion, from school, from peers, and then we walk our way through their lives. And then also weaving in the values that were ingrained from an early age, and which values have stayed, because that can inform a lot of where a person is in their current place of life. And we talk about not only the harsher things that have happened, the more traumatic experiences, but also the really beautiful, pleasurable, fantastic, like, firework experiences, first experiences. And I think that can be a really powerful awareness to recognize and have illuminated some of the most fabulous parts of a person's life. And those history sessions, because sometimes it takes one or two or three sessions to really get through a human's lived experiences, is just, there's really nothing like it, Darshana. It's one of my favorite parts of my practice with folks, is to really get their story, and then I starting to identify different patterns that they've experienced in their life, and just seeing all these light bulbs continue to light up. It is like magic. It's fabulous.
Yeah, and I think it's fabulous even for people telling their story, because how often do you get to just sit and narrate your
Yeah,
life, right?
yeah,
A lot of times things that you say make you feel like, oh, really, I've done that.
yeah,
So
exactly.
it's wonderful to see those light bulbs in your head, but also, in front of you, people
Oh,
having those
watching,
moments.
right. It's watching their light bulbs and also recognizing the resilience that each of us holds, right? So folks have come in to work with me, and that takes a lot of courage. It takes motivation and it takes resilience. And so if we can start to identify the pieces of resilience, it then becomes louder and then we have more access to it. So there's so much healing that just comes from the power of sharing your story out loud. Like that saying, shame dies when stories are told in safe places. And that's what I get to co-create with a client. And it is a co-creation. It's not just me, putting a flag up and saying this is a safe place. It's a co-creation between the two of us or more of us.
Yeah.
Mhm.
And safe feeling, or that sensation, is such a, you can't, this is a safe place means nothing to the brain. The brain
Nothing.
has to
Mhm.
feel safe.
Right.
It's one thing that you don't say, but you have to make it feel so. I love that sentence that you said. Would you mind repeating that? Shame stories,
Shame
something.
dies. Yeah, shame dies when stories are told in safe places.
It is
And that
beautiful.
safety, you're nailed it, right? Like I can't just claim a space to be safe. And many of us, especially folks who are marginalized, don't have that luxury of feeling safe, don't have it, right? And so it is in and of itself a privilege to feel safe. So that's what I mean by inviting intersectionality into our conversation, inviting a social justice or a queer theory of queering up and questioning how we know what we think we know when it comes to language, when it comes to messages. Yeah,
Yeah.
you and I just did that here in that.
Yeah,
Yeah,
yeah.
yeah.
So going back to when you said that, not every clinician and client is going to be a match. And it is so powerful to kind of know that off the bat, that if I'm not a good match for you, it's good that I tell you now so you find somebody who helps you best. So to that effect, who's your ideal peoples, right? What is your match?
Yeah. Ooh, that changes over time too, because I change over time and
Hmm.
the people who come work with me shift too. I'm very transparent about who I am on my website. And that is in and of itself going to be a filter for folks who are like, oh, yep, they're who I want to work with. That's a provider who's going to challenge me with compassion and who's going to share about their identities and invite me to look at my own. And again, that impact of power and oppression in the way that I show up in the world. Um, right now, I see a wide variety of different folks with concerns coming into my office. I work with a lot of high tone pelvic floor, general pelvic pain, and penetration disorder. This is my jam right now. I'm in love with it. I love working with vaginismus,
So we clearly
Peyronie's.
don't have anything in common.
Yeah. Yeah, you and I don't overlap in that Venn diagram whatsoever. Yeah, we have awesome talks to have and have had, you and I. So those are the folks I'm finding a ton of joy working with. Always my queer community. Being a queer person is and also working with folks who are exploring identities, exploring their gender, exploring their sexuality, exploring their relationship orientations. So LGBTQIA plus folks and relationship orientations in terms of non-monogamy are really fabulous. And kink and BDSM, which I know we'll do another segment, another podcast on at some point, you and I. Um, those right now are areas. And then folks who are motivated, who are in, part of my job is to work myself out of a job. I do not do necessarily very long-term therapy unless there's a trauma that mm, I'm trauma informed, and so I don't want to say I do short-term therapy, but also sometimes long-term therapy is not for every client. So if it is a client who's very motivated, who is willing to look at the gaps in their awareness, what I used to call blind spots, but no longer call blind spots, gaps in awareness, and be challenged with compassion, um, and look at themselves, yeah, and grow. Those are the clients for me.
Yeah, it sounds like you are waiting for them to be self-reliant, and whenever they feel they've reached that point, they're sort of they seek help when they need it. Is that accurate?
Maybe, and also maybe not feeling the confidence, but knowing that it's there somewhere.
Yeah.
And so sometimes we need someone to be able to mirror pieces and components that we can't visualize in ourselves, and I get to do that with folks. So it's not necessarily, so it's more about if there's the motivation to find the things inside of them that they know exist. That is like, that's a strength I would love to help a person with, is to find that. We don't necessarily have to show up to therapy with confidence or self-esteem or even self-love, but if there's motivation to search for that and motivation to look in and into hard stories, we don't need to dive into the deep end, but even just taking little steps to get there, and always, Darshana, with like compassion, with grace, with curiosity and interest, and moving at a slow pace. And I move at the pace of my client. I'm a resource human, so I offer tons of resources, and I let clients know that every homework assignment that's invited, or an invitation for an at-home exercise, that's what it is. It's an invitation. It's consensual. They're not obligated to do anything, but they'll always have access to those resources. So they're not going to go anywhere. I'm not going anywhere, right? And we just move along at a client's pace, and informed consent. So sharing with them who I am, and that I'm the exact same person as I am with you here, as I am with my clients, as I am with my husband, as I am with friends, as I am with my students. I'm going to show up. I'm not going to eclipse the room, and I'm not going to be the center of therapy, of course, but it's important for clients to know who they're working with, because I think that helps model integrity, which to me is values aligning with actions.
Yeah, that's wonderful, Mia. Like the invitation, because I feel like that right out the gate takes the pressure off. Because a
Mm-hmm.
lot of times people, in physical therapy, we often deal with this challenge that people will not be compliant with things that they were supposed to do. And enough number of times that happens, and you start to recognize that, okay, that's because it's too much pressure to do this long list of homework. And this
Oh,
invitation just sounds like it's optional, it's there whenever you're ready for it. So that's
two things
wonderful.
that just showed up when I heard you say that. So I recently heard a client share with me that they felt shame when a provider said that they were not in compliance, or they were non-compliant with their, I guess, treatment plan. And that's shame, right? And what that says to me is, let's slow down, because if a client is not entering into some sort of a homework or invitation, there's a barrier there. So let's start to get curious about what that barrier is, and I imagine information will be gathered from that. So
Yeah.
the non-compliance and the language we use with the folks with whom we're working matters. And if we can just offer maybe more compassionate language to non-compliance, like, I'm curious about, I've offered this as a suggestion a couple of sessions in a row, and I noticed that there's some hesitation or reluctance to enter into it. What's going on with that? Let's get curious about that. I'd love to know what one of the barriers is. And just by slowing down and taking a couple of steps back, we can learn a lot.
Yeah,
Yeah.
thank you for sharing that, because words are indeed powerful. We don't think about anything when we use them, but it's interesting to see the other side of non-compliance as a word that I have used many times, and now I will be thinking differently when I use it.
And it's a professional word, totally. And
Yeah.
again, we're trained with certain language. And what we get to do is recognize, we're on the same page here, you and I, like, language evolves, it changes over time. And if we as providers are humanistic, and if we are client and patient centered, we're going to use the patient's language, right? The person in front of us' language, and also invite compassion for ourselves, that we get to change our language as we learn it. That's growth, right? Like, we don't ever have to know all the things. We can't know all the things. That's a ridiculous feat. And also too high expectations. Reality won't have a chance to catch up to those expectations. But if we can invite curiosity and humility, number one is humility, then we can adapt our language to meet the client's needs, and then we learn. it's a process of learning.
Yeah, yeah. It's often hard to be compassionate to yourself. So thank you for kind of
Mhm.
raising that. You mentioned about like, I want to have the same definitions of words going forward. So what does queer mean?
Well, to me, it is, I don't fit into a box. I'm not a box to be checked off. And I also don't want to center straight in my definition. At the same time, it means for me that I am not what the world might consider as straight. And I also don't identify as bisexual. So my sexuality is queer. I'm also a challenger. I like to challenge how we know what we think we know. I like to question the messages that I've received and recognize whether or not this is beneficial, right, to myself and the people around me. So it's political. Being queer can be political. Being femme can be political. It can be somewhat of a term around sexuality, around gender, around different orientations and identities. And as a person who I present often as hetero, right? I'm married to a man. And so I have privilege around this hetero perception that other people have of me. And yet I'm not heterosexual, right? I identify as queer. And when I learned the term, it's almost like a reclamation of a term that used to be pretty negative and harmful and violent. And a lot of us who identify as queer reclaimed that as this is who we are. And it's actually a really fabulous, beautiful thing. And again, like one of the joys of my practice is helping folks who are exploring queer identities to invite that into our space and start to learn about a self.
Yeah. So how can these folks find you, and what's a good time to find you or sex therapists wherever they are if you're not accessible to them? Which part of that exploration it would be more helpful to have somebody help them navigate that?
So find me as in like internet, like find like Google
No,
me
like
or
you, yes, if they're,
Mhm.
but if sometimes some of the audience is not here. So
Hmm.
if they are identifying or resonating with some of the things that you said in terms of being in the phase of exploring,
Yeah.
would it be helpful to work with a sex therapist, or is it necessary, or at what point would it be helpful?
Yeah, absolutely. So I think therapy is the coolest. I think it's amazing.
And you're not biased at all, are you?
I'm not biased at all. I am. I'm totally biased. I love what I do. I love what I do, and I will I get to do this for the rest of my life. And I think that's just about the coolest thing. I'm obsessed with my job, in love with my job, not obsessed, in love with it. You're welcome to find me on, my website and also our collective. I'm in a sex therapy collective, P&W, Sex Therapy Collective. I think at any point in a person's journey, if they are interested in exploring parts of their identities and the complexity that it means to be a human, why not do it in a place that's confidential where someone who's a good fit will be able to show up for you and offer that space. I think when it comes to curiosity around identity and queerness and gender and again, sexual orientation, humans are fluid. A lot of us, most of us are going to change over time if we allow ourselves to do that, right? I like to say like it's like riding a wave instead of fighting a current. Same as who's coming into our practice. I'll notice sometimes queer folks coming into my practice, and then at other times it's folks who are primarily looking for high tone pelvic floor work, and so just kind of noticing who's coming in. So riding the wave and not fighting the current. I think sex therapists are fabulous. Certified sex therapists, we do a lot of training to get where we are. I'm also a supervisor, by the way, Darshana. I forgot to mention that piece. And I teach at multiple different organizations. So I just want to throw that out there. Additional CEUs, going to, even as not a provider, but somebody who's not a therapist or a provider, to attend their own workshops and trainings and see if they, learn some cool stuff there. Finding if it's around gender, finding a gender therapist can be really helpful. And as I mentioned before, I've got lots and lots of resources. So I'm happy to send anything your way. And anyone who is
Yes,
listening or
thank
has a
you.
friend or any colleague who's listening, you're welcome to reach out to me. And I'm
Yeah,
happy
and
to
I'll
help.
put that in show notes, all the things that you said.
Cool.
I guess my next question was going to be about something that we both care about in terms of diversity and inclusion.
Mhm.
How does that apply to sexuality and sexual expressions? Like why and how should we be diverse and inclusive?
I think, again, that humility piece comes up, being, what does competency look like? What does it look like to be constantly learning? What does it mean to be humble in what we know? How can we invite awareness when people are feeling defensive, right? What does that defensivity, being defensive, mean? What are you trying to protect or preserve? Inviting conversations for white folks around white supremacy and the insidious ways that it shows up in life, and also the isms, right? Like Sonia Renee Taylor talks about the isms and looking at capitalism and racism and how the isms show up in the way that in ways that impact every human being. Isms, ologies, and obias, right? And so in their book, Body's Not an Apology, which I highly recommend folks read. The Body is Not an Apology by Sonia Renee Taylor. I think that is how I would start to answer that question, is humility, curiosity, that this work is never complete. And the more anti-racism work I do in my life and in my practice, which go hand in hand, right? There's a huge overlap. The less white guilt I feel and the less the world feels on my shoulders. So the more I'm practicing what I'm talking about and walking the talk, the less I feel overwhelmed that everything is on my shoulders. And it's a very cool, calming, relieving feeling. The past couple of years of me diving into this work, like 3 or so years, 4 years maybe. And also there, I read an article once where they talked about, and I loved it, and I can show you the article, how anti-racism work is like, you're walking on a conveyor belt and you're going the route of the conveyor belt, and you just know, and you stop and you notice, I got to get back there. And you like walk the opposite like the opposite way around the conveyor belt. And so it's consistent energy that it takes. And so noting, how are you taking care of yourself and the folks around you so that there's no burnout around this? How does the work that you're doing and how you're showing up in the world, how can you create it in a way that is sustainable so that you can maintain this and not burn out? Because
Yeah.
it is lifelong. As long as I'm a human in this world, I'll be doing anti-racism work. As long as I'm a human in this world, I'll be seeking supervision, regardless of how many letters are after my name, regardless of how many people I'm supervising, I will still seek supervision from others. I hope that answered your question.
It
Did I answer
does.
your
It
question?
does. Yeah.